Welcome to the She Found Motherhood podcast. Today, we are talking about what is often a very confusing topic, prenatal screening. So, we have brought an expert to join us. Dawn is a genetic counselor, and we are going to talk all about prenatal screening, how to decide whether to do it, what are the different options, and what does the process look like. Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated. So before we get into it, just a quick reminder that this is kind of a general podcast. So if you've had a history of a chromosomal difference, or if you personally have one, or there's been really high risk factors, we want to make sure that you actually talk to your care provider about individual advice for you. Now, that goes without saying for most pregnancies, but specifically around this topic. So we're going to get into it. And Dawn, why don't you tell us a little bit about yourself?
Thank you so much for having me today. I'm very excited to be here and to have this chat with you. So I'm a genetic counselor at Life Labs Genetics. I have been in the genetic counseling profession for over 20 years. So I've seen a tremendous growth and expansion with the profession, which is very exciting. Prior to my role at Life Labs, I worked at the BC Women's and Children's Hospital in the Provincial Medical Genetics Program. I was there for 13 years, where I really focused on prenatal and general genetic counseling. I really feel blessed to have found this profession. It is an amazing profession. I look forward to going to work every day. I really appreciate being able to educate people and empower them about genetics and making really informed decisions about their health, and educate healthcare providers and keep them up to date on this rapidly changing field of genetics. I find it extremely rewarding profession for sure. In my personal life, I'm very blessed to have 2 healthy, beautiful children, a wonderful husband, 4-legged fur baby. We love getting outdoors. We love hiking. We've done that pretty much every day in COVID. We love to travel, which we can't wait to do again one day in the distant future, and love getting together with family and friends. And of course, we're missing that tremendously too.
Awesome.
So thank you so much for having me.
Well, thank you for joining us. And you touched on it. It is an ever-changing, always evolving topic, which is part of the reason why it can be such a challenging conversation to have, to make sure that people are aware of all the options out there, but also make sure that they're making the right decision for their family. And so we're going to kind of briefly go through that today. Obviously, we can't cover everything because this could be a 5-day long lecture if we did. I'm joking a little bit, but we'll kind of do a good brief overview, and we'll kind of get to the basics so that you can have a really good discussion with your care provider about what's the right decision for you. So I think let's get started with, how do you even decide whether or not to do prenatal screening? So this is a topic that is very much individualized. And I kind of say to my pregnant people and their support people, I break it down and get pretty general, but there's kind of 3 camps of people in this world, I think. One is, if it happens, it happens. If I have a baby with a chromosomal difference, then it happens. I'll deal with it at the time. I don't really want to know about that. I'm not going to change the outcome of my pregnancy. So I'm going to choose to not do any prenatal screening. And that's totally fine. The other camp is, I know my family situation, and we really couldn't support a baby that had a major abnormality. So we might actually choose to terminate our pregnancy based on that information. So it's really important for us to know that information. And so that family should definitely get prenatal screening. Most people sit somewhere in the middle. I'm not really sure what I would do with the information, but I think I would like to have it so that I could prepare and make the right decision for my family. So most people do prenatal screening with that. So let's kind of go back to basics. And Dawn, what are we talking about when we're talking about prenatal screening?
That's a great question. Prenatal screening is really meant to identify if a pregnancy has an increased chance to have that baby affected with a certain genetic condition. These are caused by extra missing chromosome material, such as Down syndrome or trisomy 21. And there are more rare conditions, such as trisomy 18 or 13. Now, these chromosomal conditions are usually sporadic, so there's generally no family history. There's nothing a woman does or doesn't do in her pregnancy to cause these conditions. However, they do happen more often as women get older. Some prenatal screening also can detect structural anatomical differences like open spina bifida. Now, in most, if not all provinces, there are government-funded options for first-tier screening that are covered by your provincial healthcare. And these are called maternal serum screens. There's lots of different names for them depending on the province you're in. First trimester screening, enhanced first trimester screening, integrated prenatal screening, quadruple marker screening, but generally they all fall under the umbrella of maternal serum screening. Now in BC, the funded screening comprises of 2 blood tests, and these blood tests measure the hormones and proteins that are in the maternal blood circulation that are produced by the baby and the placenta. And there's 2 blood tests, one that can be available between 9 and the end of the 13th week of pregnancy, and another blood test between 14 and the end of the 20th week of pregnancy. Now, if a woman is 35 or over, she can also get an ultrasound that's done between 11 and the end of the 13th week of pregnancy that measures the back of the fluid behind the baby's neck. This is called the nuchal translucency ultrasound. Now, if a patient presents, later in pregnancy or misses that first blood test, they also have the option of getting just the second blood test. And these hormones and proteins in these blood tests are combined with the measurement on that ultrasound if the patient has the ultrasound, and they are provided with the chances that that pregnancy has one of these chromosomal conditions.
So
now
this
in BC,
answer, I just like to say, this answer, right, is not a yes or no answer, this information we get, right?
Exactly.
It's like
yes, this is a screen.
Ratio. Yeah. So you get
Exactly.
the risk in this particular pregnancy of having a baby with a chromosomal, what we call abnormality or difference that could lead to one of these conditions, right?
Yeah.
Yeah.
So you're essentially provided a chance. So your chance is either higher or lower than before you had the test. And the screen mainly looks for Down syndrome, which is an extra chromosome 21, trisomy 18, which is an extra chromosome 18, and as well, those are chromosomal conditions. And then spina bifida is a birth difference, birth defect, an opening in the baby's spine that the prenatal screen also can screen for.
Yeah. And so a report would come back about 7 to 10 days, generally speaking, after that later piece of blood work that would give you a risk ratio. So a really low risk would be a 1 in 20,000 chance, let's say. Yeah. And a positive screen in BC anyways is now a 1 in 900 chance. So this is a bit of the issue with these tests, right? Is a high risk test still, I'm breaking it down very generally, 899 times out of 900, if you get a 1 in 900 screen, you're going to have a baby without these kind of chromosomal differences, right? So
absolutely.
So these tests are a good screen, but they also can lead to a lot of parental anxiety if you screen positive, and most of the time everything is fine, right?
Absolutely. And everyone deals with risks differently. So for me, a 1 in 900 risk might seem really high, but for someone else, that might seem really low. And there's no right or wrong answer of how you perceive these risks. But you're right in that most of these high risk or positive screens, actually, the pregnancy is not affected. And so that can lead to a lot of anxiety.
Exactly. And with these maternal serum screens, occasionally the test is kind of quote unquote positive, not because there's an abnormality with baby, but they can sometimes detect things that might happen in the future. So certain markers can be a bit different if the pregnant person's at a little bit higher risk for blood pressure issues or kind of growth restriction issues. So every once in a while we get a bit of a clue to that. But in our community anyways, and I think across Canada, pregnant people are so closely monitored, just generally speaking. So we see people frequently, we check their blood pressure, we get ultrasounds. We're privileged enough to be in a community that we can really keep a close eye on people. And so oftentimes having this little bit of extra information is a good thing, but not always. It's not necessary, generally speaking. So I think
Absolutely.
that's a good recap of the maternal serum screen. And there's also kind of the newer player on the block, the non-invasive prenatal test or prenatal screen. Can you tell us a little bit about that?
Yeah, certainly. So non-invasive prenatal testing or non-invasive prenatal screening, NIPT for short, or NIPS, is available as a first-tier screen, but on a private pay basis. Specifically in BC, certainly it can vary per province, but as a first-tier screen in BC, it is a private pay test. Now, NIPT, instead of looking at these hormones and proteins that are made by the baby and the placenta in the maternal circulation, NIPT is actually looking directly at the DNA from the baby, more specifically the placenta, that's floating around in the maternal blood circulation. And even though we're testing the DNA from the placenta, the placenta starts off as one with the baby and they eventually split apart. So most likely that DNA is representative of the DNA in the baby. So from analyzing this DNA, it can be determined whether the pregnancy is at increased chance of having one of these chromosomal conditions like Down syndrome. So there's a few main advantages of NIPT over the government-funded maternal serum screens, which again measure the hormones and proteins in the pregnancy. Now, the first advantage is NIPT is a much more accurate screen, so significantly less false positives. We talked earlier about that 1 in 900 chance, or the increased chance that you get, which still is generally a lower risk. So most of those are false positives, and that can lead to a lot of anxiety. With NIPT, it has a much lower chance. So if you screen high risk, there is a very good chance that that pregnancy is affected. But again, it is not a diagnostic test. It's a screen. There's going to be false positives and false negatives. The second advantage with NIPT is that results are typically available much earlier in the pregnancy. So typically you're going to get a result back later in the first trimester with NIPT. But with a maternal serum screen, results usually aren't available till about 16 weeks at the earliest after your second blood test. Now that can vary again per province. For example, in Ontario, they do the enhanced first trimester screen or their first trimester screening, so you will get results back earlier.
So, and that's just a shortened version of the maternal serum screen, essentially with an ultrasound added in. I actually had that in my second pregnancy. And my babies do not grow nasal bones. And my second baby, I was, we call it advanced maternal age. I had a patient come in, sorry, I digress. I had a patient come in who's 36 and said the Emerge told her she had a geriatric pregnancy. I said,
I have read that in consult letters.
I was of advanced maternal age. So I got this first trimester screen, which is positive because my children don't grow nasal bones. So the ultrasound is looking for certain markers that are more indicative of having a baby with a chromosomal abnormality. And she had a thickened neck. Anyways, I went on to get the NIPT and everything was totally fine. But that's one of those things, right? It does come back with those positive screens, which cause a huge amount of anxiety. And so the NIPT is a very, very good screening test for giving us reassurance. So anyways, the first trimester screen used to be in BC. I don't know that it is anymore, but I think it is in Ontario still, hey?
Yes, it is. And I think it is available at a couple of the private clinics in BC. I don't have a lot of details on that, but I think you could get it on a private pay basis. But certainly in Ontario, that's the main government funded screen.
Fair enough. Perfect. So the NIPT test is also if you screen positive, again, and this is in British Columbia, if you choose to do the publicly funded test and you screen positive on that, you will then be offered the NIPT as the follow-up test, government funded, because it is a much better screening test than the maternal serum screen. But the government is not yet funding it to be done first line for publicly funded screening. So some people definitely choose to do the NIPT private pay early on.
Absolutely. That's exactly what I was going to say next is that, yeah, the NIPT is a government funded second tier test. Essentially, if women have screened positive with their maternal serum screen, they will be offered an NIPT that is government funded.
So we're throwing out all these words and all these acronyms and your head is probably spinning. So there's a couple of great websites that you can go look at, which we will put in the show notes below. If you want to kind of read over this 5 times after listening to this podcast 5 times to try to get all this information straight in your brain. So we know Life Labs has a great one. What's the Life Labs?
Lifelabsgenetics.com.
Yeah. Is a great website to learn more about the NIPT test, the panorama specifically. And then what is the other recommendations that you have for websites, Dawn?
Yeah, another really good resource is the BC Prenatal Screening. That if you just Google that, BC Prenatal Screening, you'll come up with that website. And it is an excellent resource for both healthcare providers and individuals thinking about screening. It has a really good decision aid video on there that talks about, what are my options? And, I do have this option of doing no screening, and that's okay. But I also have the option of doing screening, and what are my options? So it is an excellent resource, and I would encourage anyone who's pregnant or thinking about pregnancy to take a look at that website. And certainly the lifelabsgenetics.com website is also a good reference for individuals who are thinking about NIPT as an option for screening.
Yeah, it's great. And the other thing is we have to usually make these decisions pretty early in pregnancy. Like we're talking about kind of 10, 11, 12 weeks at the latest. And so if you are thinking about becoming pregnant or trying to conceive, starting to learn about these things early is actually really important, because you have to make that, in that first trimester when you're feeling gross and you're nauseous, but you're excited and there's all this stuff going on and you're learning all of these new things. So starting to educate yourself a little bit before, if this is something that you think you might be interested in, is really important. Yeah. The other piece of the puzzle is we do an anatomy ultrasound. So around 20 weeks, we do an ultrasound that's looking at how baby's developing. So we look at their brain and their heart and their kidneys and their stomach and their fingers and their toes and their face. And then we look at how your pregnancy is going. So the amniotic fluid and where your placenta is living, and how long your cervix is. So that essentially is also a screen. And so people need to recognize that as well. And occasionally people will choose to do no prenatal screening, like the maternal serum screen or the NIPT. But something will come up on the ultrasound, which could be totally normal, but could also be an indicator that there might be something going on. And so that's also another time that we, have a conversation and can make a choice. And we do have options at that point as well, if you choose to then do some prenatal screening as well. So people kind of forget about that sometimes, and then things will pop up and there'll be anxiety around that. But we do still have options at that point. We're just now talking kind of 21, 22 weeks to get the information back, which can be a bit of a challenge time-wise, but we do have that option.
Yeah, absolutely. And people do forget about, they get really excited, and that's very understandable, about their detailed ultrasound and getting to see their baby and getting to see it move. But you also have to keep in mind that it is a medical screen to look for certain birth differences, like a heart defect, because your pregnancy would be dealt with very differently if all of a sudden a heart defect was identified. So
exactly.
It's a good point.
Just found out you're pregnant? Congratulations, that's wonderful news. Once you've had time to process this, it's never too early to start preparing for your pregnancy journey and birth. So, what now? Let's start with a simple checklist. Number 1, buy prenatal vitamins. Number 2, book an appointment with your doctor or midwife to discuss your pregnancy. Number 3, order Panorama.
Hold on. Let's talk about number 3 a little bit more. Panorama is a non-invasive prenatal test that can tell you if your baby is at risk of having certain genetic conditions. This is a screen that provides new parents with the peace of mind they need early on in the pregnancy so that they can be better prepared and plan for their family. Most prenatal screening tests are an optional part of your pregnancy care plan, but well worth your consideration.
chances are your baby will be born perfectly healthy. The advantage of ordering Panorama is that it can tell you more about the health of your baby as early as 9 weeks. And the test is simple. Panorama is done through a simple blood draw from the pregnant person's arm, so there's no risk of miscarriage. One of the key benefits is that Panorama reduces the need for invasive procedures, such as amniocentesis and chorionic villus sampling. That's right. And Panorama is the only NIPT that differentiates between the pregnant person's DNA and the baby's for accurate and reliable results.
And did you know that Panorama screens for Down syndrome with an accuracy of greater than 99%? The risk of Down syndrome goes up the older the pregnant person is, but Panorama can also screen for some common chromosomal differences that impact all pregnancies equally, regardless of age. It's a screening test for everybody. To learn more, visit lifelabsgenetics.com.
So, Dawn, we used to have a couple of tests that were a little bit more common that we would use, amniocentesis and something called chorionic villus sampling. Can you tell us a little bit about those and how they differ from the maternal serum screen and the NIPT we just talked about?
Absolutely. Yeah, so both the maternal serum screen and the NIPT are screens. They're not diagnostic. There are going to be false positives and false negatives. Now, diagnostic prenatal testing is different than prenatal screening, and it can be done two different ways: by an earlier test called CVS, where we're taking a piece of the placenta and looking at the genetic material to see if that pregnancy does have a genetic condition. And then there's the amniocentesis, which is taking some fluid from around the baby and looking at the genetic material that way. Now, these are diagnostic, meaning they are essentially 100% clear answer. Now, there are rare exceptions to that where sometimes there might not be a clear answer, but that is the exception. Diagnostic testing, though, unfortunately comes with a risk of losing the pregnancy from the procedure. And that's why it's really only reserved for individuals who have a higher chance of having a pregnancy with one of these conditions. And it has to be higher than the chance of a miscarriage from the procedure.
Yeah, awesome. And certainly there are occasionally people who choose, even though this is the screen that they want to do or the diagnosis they want to do, without doing the other screens, and that's fine. But how you have to have an informed discussion with your care provider around the risks and benefits of that, depending on kind of what that looks like for you. So that's really important to know. So those are the tests that we would use to confirm a high suspicion of a chromosomal abnormality based on either the maternal serum screen, but most likely the NIPT, because we would do one and then the other, and then we would go on to do that diagnostic. So a for sure yes or no versus a we think yes or no, which is a screen. And the false positive and false negative that Dawn's been talking about. So a false positive is when you get a positive result, but everything is actually normal. And a false negative is when you get a reassuring result. So you get everything looks fine, but actually there is something going on. And so those false positives and false negatives are just a nature of our screening tests because they're not perfect. And so you want to look for a screening test that has the lowest risk of getting those answers wrong. And so the NIPT has much lower false positive and false negative rates than the maternal serum screens. So that's a little bit about that, but that's kind of essentially all we need to know is that the NIPT is a much kind of better test, a more specific test than the maternal serum screen for those reasons.
Exactly. Thank you for clarifying that.
All right. So now we have a basic understanding of the different types of prenatal screening. We're going to talk a little bit more about the NIPT specifically. There's a couple of different ways that the NIPT is done. There's kind of two major methods. One is a counting method and one is what we call a Snip method. So can you tell us a little bit about those two different types of technologies, I guess?
There are certainly many companies that offer NIPT, and it can be overwhelming trying to decide on which one to have. So I'll do my best to point out the main differences, but it is important to do your research and talk to a healthcare professional like your physician, midwife, nurse, or genetic counselor to really make an informed decision about any screening option. Even though there are many companies that offer NIPT, there are really only two technologies for doing NIPT. One is called the counting method, and one is called the Snip-based method. Now, as I explained earlier, NIPT, like the maternal serum screen, is meant to screen for genetic conditions that are caused by missing or extra chromosomes. For example, Down syndrome, which is caused by an extra chromosome 21. The NIPT, of course, is more accurate, can be done earlier in pregnancy, and can screen for more chromosomal conditions than the maternal serum screen. The one NIPT technology called counting method basically counts all the chromosomal pieces in the maternal circulation. So there are chromosomal or DNA pieces from the pregnant woman and chromosomal pieces from the baby or placenta. They look at all of this chromosome material and try to determine whether it looks like there may be extra or missing chromosome material in total from what is normally expected, hence leading to a high risk for that specific condition. The second NIPT technology, it's called the Snip-based method. The only NIPT out there that uses this technology is Panorama, which is the NIPT that LifeLabs uses. This technology works by looking at the DNA fingerprints, kind of like in forensic science. The difference with this technology and looking at the DNA fingerprints is that Panorama can distinguish between the pregnant woman's chromosomal material or DNA and the baby's DNA, which the counting methods can't do. From the baby's DNA profile, it can be determined whether it appears to be missing or extra chromosomes. So this ability to differentiate the pregnant woman's DNA versus the baby or placental DNA is important as it leads to less errors in the screen, so less chances that there would be a false positive or a false negative.
Okay, so we've kind of talked about the differences in technologies, the SNP versus the counting, and kind of the benefits of knowing the difference of mom's DNA versus and babies being separate in the SNP technology. But there's some other benefits of that technology and something called the fetal fraction. Can you tell us a little bit about what the fetal fraction is specifically?
Yeah, so fetal fraction is a very important term in the NIPT industry. So the fetal fraction is the amount of the DNA that's in the maternal blood circulation that is from the pregnancy itself, from the placenta is what we're testing. And it makes sense that there has to be enough of this pregnancy DNA to be tested. Otherwise, you'd be testing just the maternal DNA, which really defeats the purpose of prenatal screening. So I would strongly recommend anyone considering NIPT to make sure that the lab that they choose does report out the fetal fraction and they have some sort of cutoff for the fetal fraction to ensure a reliable result. Now, with the SNP-based technology, Panorama, we can typically get a reliable result at a lower fetal fraction of 2.8% or above. With most of the counting methodologies, because of that technology, they do need a higher fetal fraction of getting a reliable result, usually about 4% or higher.
So in terms of like for real life purposes, what does that mean? So what would be the benefit of needing the lower fetal fraction? What kind of pregnant people would that benefit?
So that's a great question. Now, we do know that there are certain factors that can influence the level of the fetal fraction. One factor is maternal weight or BMI. So we do know that the higher the maternal weight or the larger BMI can actually dilute out the fetal fraction. And so Panorama can have some advantages in women who are heavier because we can typically get a result at a lower fetal fraction.
Yeah. And so BMI is body mass index. So essentially your weight to height ratio. So for people who are obese or more obese, then they're going to have more of their chromosomes compared to their baby. So that's what we're talking about. So the more tissue that you have, the more chromosomes you slough off into your blood system. And so it would dilute out baby's blood system. So by having one that needs less of a fetal fraction, you're more likely to get an accurate result with something like the Panorama versus the counting methods that need more of baby's DNA in there to get a guarantee. I would imagine also the smaller your baby is, the less fetal fraction they're going to have. So maybe the counting method can be used just slightly earlier than or be a bit more specific, a bit more appropriate at an earlier stage, like maybe 10 weeks as opposed to 11 for the counting method, which would just allow us for that information a little bit earlier. Is that correct?
Yeah, so the SNP-based NIPT can be done as early as 9 weeks of pregnancy, whereas with the counting methodologies, because they do need a higher fetal fraction, you can't do that until 10 weeks or greater.
Great. Awesome. Now, are there any other advantages from one technology over the other one that we haven't talked about?
Yeah, I would say a big advantage with the SNP-based technology is in twin pregnancies. With twin pregnancies, we have the advantage with the panorama NIPT of determining the zygosity of the pregnancy. So that essentially means we can determine whether it's a fraternal twins or identical twins. And we can also determine the individual fetal sexes of each twin, which, can be important for some people to know. And then fetal fraction, we can also determine the individual fetal fraction, again, the amount of the DNA from each twin in the sample. Whereas with the counting methodologies, they usually report a general average fetal fraction.
Right. So with the SNP technology, why the zygosity is important, because if you're having fraternal, so there were two different eggs, we know that it's the lowest risk of the twin pregnancy. So two separate babies, two separate sacs, two separate placentas. That's the lowest risk pregnancy if you're going to have a twin pregnancy. Versus if they came from the same egg, there's a risk that they share a placenta or sac, which increases the risk. So knowing that a little bit earlier can actually be really beneficial in terms of a care plan. That's really important. And then also being able to differentiate the two babies, because if they're fraternal, they came from two different eggs. And so if one of those eggs had some chromosomal abnormalities, but the other one didn't, then one baby may be affected, the other one isn't. So it's good to kind of have that information versus just a general kind of risk. You don't know what's going on there, and it can cloud the picture a little bit. So that's what kind of Dawn was talking about with those kind of like, we can actually look at each baby individually as a separate unit, and we can also potentially know if there's a bit of a higher risk pregnancy in terms of the twin world earlier on, which is great from a care provider point of view, because we do manage those pregnancies very differently. And sometimes our ultrasounds, although they're good, are not that, like, it's depending on when you get your ultrasound, we don't always get the best pictures of that placenta and whether they're separate or they're together. And so this information can add to that, which is fabulous.
Yes.
Okay.
Yeah, absolutely.
Awesome. So here's the situation. I'm pregnant. I'm not pregnant. I'm pregnant. How do I go about getting genetics or prenatal screening? What do I do?
So it's, very important to have that discussion with your healthcare provider as early on as you can in pregnancy. If you decide, to have prenatal screening, again, there's certainly different options for you. Now, if you decide on NIPT, and specifically if you decide on panorama NIPT, we can talk a little bit about that process. So you would just need a requisition that is signed by your healthcare provider. And there's also a consent form available with a requisition or on the Life Labs Genetics website. And I highly encourage everyone to read that consent form before having the test. And that goes for any test that you're having, essentially. Now, they can take that signed requisition to any of the hundreds of Life Labs patient service centers. Now, if your province doesn't have a Life Labs collection center or patient service center, we can also send kits out. The testing will be performed right here in Canada in our Ontario Genetics Lab, and the results take about 7 to 10 days. So similar to the maternal serum screen results. And then with the results, they're delivered only to your healthcare provider. And I believe that would be the case for any NIPT lab out there, just because the sensitive nature of these results and the complex information on them, we always want to make sure that the healthcare provider is getting a copy.
Yeah, exactly. And I'll speak to that because I do that side of things. So essentially what happens is we get the report back in our medical record, and then we would discuss that report with the patient. Now, the reason why it's really important that only we get that results and you don't is because if a result comes back positive, we actually do quite a bit of background work before we even have a conversation. So we talk to the genetic counselors, we talk to our obstetrical specialists, we kind of make a plan for the pregnant person and their partner, their family, around what the next steps are and have it all organized so that when we have that conversation with the patient, who it's a big conversation and it's a scary conversation, we have a plan in place if they want to move forward with that plan. Some people choose to, some people don't, and that's totally fine. But we like to make sure we have all that information to give to the person at that time. Otherwise, they leave the appointment, they don't know what's going on. It's this huge, whirlwind of emotions that happens with these positive screens, whatever they are. And so we like to make sure that we have all of that back work done before we even kind of talk to the patient around that information. And so that's why it's really important that we get the results and then give them to you for sure.
Yeah, that's a good point. And when we have the high risk NIPT results, we do make that recommendation that that individual should be referred on to genetics to speak with a genetic counselor about that high risk or positive screen result and be offered diagnostic testing. Again, the NIPT is a screen, and we want them to have the option of diagnostic testing before any kind of irrevocable decision is made about the pregnancy. They may not decide to have the diagnostic testing and just continue on and determine that at birth of a baby, but they need to have that option to confirm that NIPT finding.
And also, if you do have a positive NIPT screen, and you choose not to go on to an amniocentesis, say, or you're not going to terminate your pregnancy, but you did want the information, we actually are going to manage your pregnancy a little bit different, because you would then be considered a high risk pregnancy, and we would want to keep a closer eye on baby and a closer eye on you, and you might need to deliver in a different center based on kind of your community and what kind of capabilities they have for caring for a baby with whatever that looks like. So there, it's a really important kind of discussion to have and to kind of move forward with, which is why we have all that kind of back planning before we even have that discussion, to make sure that we have that good plan in place. And especially for communities that are kind of do lower risk deliveries or lower risk pregnancy care, that might mean that you may need to go out of your community. So coordinating that, so there's a good plan in place before having that discussion is really important. So yeah. So we've kind of chatted about a lot today.
Mm-hmm. A lot covered.
Is there anything that we haven't talked about, Dawn, that I forgot to talk about that you think is really important that we chat about?
No, I think that we've covered everything. I mean, we talked about that prenatal screening. It's an option for everyone, but not everyone has to have it. There's no right or wrong answer to the path you choose. It's a very personal decision. I guess we talked about the importance of being well informed before deciding if you want prenatal screening. The BC Prenatal Screening website, again, is an excellent resource. It has a lot of valuable information. If you decide to have prenatal screening, there are government-funded options, the maternal serum screening, and then there's the private pay options, mainly NIPT. No matter how accurate the NIPT is, again, it's a screen. It's not a diagnostic test, and there's going to be wrong answers or false positives and false negatives. And again, there's many NIPT labs out there, but there's two methodologies for that NIPT, the Snip-based and the counting-based. The Snip-based is Panorama, which Life Labs uses. Again, important to speak with your healthcare provider and contact the specific labs to ask questions and do your research before deciding that route. And then it's important to not make any kind of irrevocable decisions based on high-risk NIPT results. The finding always needs to be confirmed by diagnostic testing if you're going to change your decision about the pregnancy.
And then we didn't talk about the cost, and the cost of doing a private NIPT is generally about, and don't quote me on this, it's about $500-ish, regardless of the technology that you choose. Generally speaking, there is one that's a little bit less expensive these days, but it's not available everywhere. But the main two are about $500-ish each. So it just depends on kind of where you want to get it done and what technology you want to use. And we also talked about the importance of knowing that they do tell you the fetal fraction, so you can actually make sure that you are getting the appropriate information back from your test. And we also talked about a few different cases in which the Snip-based technology specifically, or the Panorama, would be more beneficial and more likely to get you that appropriate fetal fraction result. So we know that the information is of benefit. And we also chatted about twin pregnancies and how the Snip-based technology can really be advantageous in that to help us in terms of determining what kind of babies you're having, both gender, but also are they chromosomally the same or chromosomally different like their siblings. Perfect. Well, that is a lot of information packed full in a relatively short, kind of longish podcast. But again, we're going to put those websites below so you can go and look more into this. This is just kind of a general idea so that you can have a bit of more of an informed discussion with your care provider to decide if you want to do prenatal screening and what is the right screen for you to choose for your family and how you would use that screen information when you get it. Great. Well, again, thank you, Dawn, so much for joining us. A complex topic.
Thanks so much for having us.
Have a great day.
You too.